Welcome to the Etiology Hyperpigmentation Presentation. I'm Catherine Pacelli, and I'm going to be talking today about one of the most unique subjects as an esthetician can face, which is hyperpigmentation. These are our new Etiology products. I love the new packaging. They look very elegant, clean, and neat. And as you can see, we have all of your favorites. They've just been repackaged and renamed to kind of update our skincare line. This is me. I'm a master clinical esthetician, director of medical aesthetic training and services for Etiology, and I've worked with plastic surgeons in La Jolla and Del Mar for 14 years. I've been director of education for many of the top leading brands, and I've also received advanced training in aromatherapy, phytotherapy, and naturopathic skin ingredients. I currently own Sanctuary Day Spa. We've had it now for 11 years. It's a great business. We love it, and it helps us use the products and have real hands-on practical experience. Let's talk about etiology. The products were developed from medical research and documentation. It was designed by a plastic surgeon, and the reason that he designed these products is that after surgery he was looking for products that would give the surgery longevity and help the skin and keep the skin looking young and fresh, and he really couldn't find any. So he worked with a chemist to develop this line, and it's been in use now for up to 30 years. It's all clinically tested, and it's been successfully used by thousands of patients and thousands of clients in day spas. Our advanced products are patented, and that's very unusual in the skincare industry to have patented products, and we're very proud of that. We're going to be talking about resurfacing aging skin, hyperpigmentation skin, lightening and balancing, some ways to control acne, prevention and maintenance, and nourishing the skin, because etiology does all of that and more. Let's talk a little bit about cosmeceuticals. Cosmeceuticals is a new term that came into the arena about 30 years ago. Up until that time, skincare, all it could really do is work on the surface of the skin, and it really didn't penetrate down where it was needed. So Dr. Kligman, who formulated Retin-A, he proposed a new category of products termed cosmeceuticals. It's a term that's derived, of course, from cosmetic and pharmaceutical. And this is what our line is. We are a cosmeceutical line, so we are a step up from the more holistic foo-foo lines. We definitely have products and ingredients that go down into the skin and make a visible difference. It's the strongest generation of cosmetics to date, and we contain highly effective ingredients. All products are developed from medical research and documentation. As I said before, it was formulated by a plastic surgeon. So let's talk about hyperpigmentation. Well, we know as estheticians, it's a discoloration of the epidermis of the skin caused by the production of melanin. There are several pigment disorders besides just having blotchy brown spots on your skin. There's vitiligo, which actually causes hypopigmentation and causes the area of the skin to be completely white. There's chloasma or melasma, which is a brown pigment. You often see this during pregnancy. There's lynchogens, which is solar freckles. There's nevi, which is a birthmark. And there's hypopigmentation, which we talked about, which is white patches or spots. Pigmentation is melanin. It functions to protect the skin from UV exposure. So when you go out and you bake yourself and you have this beautiful tan, that is really nature's way of protecting the skin because the skin has been injured or burned. So I know it looks great, but what happens is the cells of the skin actually are affected and damaged by the skin, and so the melanin comes up in an order to protect the skin. The tyrosine production is stimulated by the UV exposure, and tyrosine causes the production of melanin or pigment. The causes of hyperpigmentation, well, there's some with hormonal therapy, injury meaning taking pimples and picking at them to the point where you end up with brown or red spotches on your face. Of course, sun exposure, and then like we talked about, pregnancy. The melanocytes are very much a contributing factor. It's called melanin synthesis, and it transfers the epidermal melanin unit. Now there's different degrees of pigmentation, and the Fitzpatrick classification is what we really use as our Bible to determine which of the types is going to be best suited to what type of peel. The 1 to 4 is the dark brown melanin in types 3 to 4, and that is really works well with hydroquinone. But the lighter pigment found in Asians, we find that kojic acid and ascorbic acid works better with that type of group. There's other factors. There's estrogen stimulates skin pigmentation. Growth factors have a direct relationship with the stimulation of melanin. 19% of women on contraceptive drugs develop melasma. I have a lot of clients, the young girls coming in, and they are having hyperpigmentation for the first time in their life, and it's because they're on birth control pills. 87% of these develop pigmentation during pregnancy. That is very common, and it's usually in a butterfly pattern, and it does go away after pregnancy. Sometimes it doesn't, and we have to treat it with our peels and our hydroquinone. Melasma most common in brunettes when exposed to sunlight. Here's the pathogen by Dr. Jill Matt. The dermatological problems, especially acne scarring, pregnancy, hormones, menopause, sun exposure, photosensitive conditions. There are medications that I take that definitely tell me I cannot go in the sun. And if I do, I'm going to have burning and other areas of the skin. And of course, like I talked about, the drugs. Skin disorders associated with hypopigmentation. Well, insufficient number of melanocytes and defect in melanin synthesis. As we get older, I am noticing that I am getting little groupings of melanin. Before, when I would go out in the sun, I would really have a nice tan. And it's because as I age, I do have an insufficient number of melanocytes. It's not real noticeable, but I can really see the difference. Of course, we talked about vitiligo. This is very common, especially in people who have darker skin, and it's more noticeable. And there's no cure for it at this time, and it can be a very unsightly disease. Let's talk about the Fitzpatrick classification. We have skin types 1 through 4, which we talked about, which is hydroquinone. It works very well for this type of client. And the darker you get, the more I would use kojic acid because it just gives you a better result. Now, I put together a schematic for you to kind of tell you how Fitzpatrick classification arrived at their classification. And it has to do with your ethnicity and where your ancestors were born. Because no matter where you live, your genetic code is programmed to your ancestries, and so that is what's going to determine how well you respond to peels and to treatment. Now, if you're up in the cold, dry areas where there's no sun, that's usually your Scandinavians and Norwegians. There's blonde hair, blue eyes. They're not prone to hyperpigmentation because they don't have a lot of melanocytes genetically, but they may be prone to hypopigmentation. Your Nordic, Scandinavian, Swedish, German, but they're more prone to skin cancer because they don't have a lot of melanin protection. And of course, number 2 is you're going down a little bit farther now towards the warmer climate, and that's usually your Scottish, Irish, English, Welsh, and Polish, and Celtic. And they have the red hair, light eyes, white skin, and freckles, and they're very prone to rosacea. My mother was Irish, and she had a lot of rosacea issues. Going down further towards the equator, we have number 3, which is darker hair and eyes, prone to hyperpigmentation. You have Russians, Native Americans, and some Asians. And going down into 4, you're right down there at the equator. So you have Native American and you have people from India, and they're very prone to hyperpigmentation. Middle Easterns, Italians, this ethnic group has a lot of melanin, and it comes up with sun exposure or any other of trauma like acne and other things to the skin. Number 5 is we have the Asians, African Americans, and Hispanic, and that's right down into the warmest parts, and they have the dark hair, skin, and eyes. And then we have the very dark hair and eyes, black skin, but very sensitive. And you have more of that, your Africans, and some Middle Easterns, and some Indians. So this is how the classification came about by your ethnicity. And your ethnicity determines how well the peels will work on you and what type of peels we should use. Preventing hyperpigmentation. Well, sunscreen is the only thing that's really going to work. If you have prone to hyperpigmentation, you need to wear sunscreen even if it rains or snows, because the UVB and the UVA rays are out there and they destroy the skin cells and they activate the tyrosine, which makes the melanin come up. So it helps prevent melanin production, hyperpigmentation, and what I talked about, those pigment clusters that I get now because my pigment is not uniform like it was when I was younger and I was getting those great tans. Dermatologist Mark Rubin is a professor of dermatology at UCSD, and he recommends for home care that you use alpha hydroxys, glycolic acid, retin-A, hydroquinone, kojic acid, topical vitamin C, and that the peels you can use are the alpha hydroxys, the Jesners, and you can do laser peels if you have a dermatologist that you go to. So our products contain all of the ingredients that he recommends in the home care. Hyperpigmentation specific ingredients. Well, we talked about the tyrosine, and you need to inhibit that tyrosine, and those are bleaching agents. They usually block the production of melanin. Hydroquinone, our products have hydroquinone. It blocks the production of tyrosine, which prevents melanin production. Mulberry extracts, it's an enzyme derived from fruit. It declusters the melanocytes and blocks the skin's reaction to tanning. And of course, retinol, vitamin A, which we also have, produces a mild superficial peel of the epidermis, but does not affect the dermis where the pigmentation starts. More ingredients that we use for hyperpigmentation: glycolic acid. It reduces the topical density of the pigmentation. Vitamin C. It's a skin bleaching agent, and azelaic acid is an antibiotic agent that inhibits DNA synthesis to interrupt hyperactive melanocytes. Okay, the key focus is the tyrosinase, and that is the enzyme that releases the melanin. And also free radicals are produced from UV A and UVB, which causes hyperpigmentation. More ingredients for the prevention of hyperpigmentation is kojic acid. We have kojic acid in our products, and it is combined with ascorbic acid, which gives you a wonderful cocktail of ingredients that will really help the more Asian population or the dark skin type or pregnant or lactating woman. Sunscreen, of course, is a given. You have to have sunscreen. It blocks the tyrosine, which is the enzyme responsible for stimulating the melanin production. Treating darker complexions. Well, you know, I always thought that the darker the skin, the less sensitive the skin would be. And that's not true. I found out that the darker skins are more sensitive than the lighter skins. Individual with hypersensitivity can hypopigment or hyperpigment easily. So begin treatment with these skin types slowly and carefully. Always do a patch test before you do any peeling at all. I do a patch test the day before, just have them come in and put a little of the ingredients on the inside of the elbow. It will save you a lot of grief in the long run. How do etiology cosmeceuticals treat hyperpigmentation? Why, we have a very effective hydroquinone combined with our glycolic acid to lighten and smooth the discoloration. And the hydroquinone also suppresses the melanin. That is a wonderful product that we have, and it's very, very effective. Now, we also have kojic acid with ascorbic acid, and it's safe to use, and you check with your physician if you're pregnant. But this is recommended more for darker complexions or Asian skin. The Salon Professional Exfoliating Peels for Hyperpigmentation. Highly effective if the pigmentation is within the peeling depth of the epidermis. Peeling in combination with hydroquinone is much more effective, and we recommend that in our treatment protocols. Home care regime, 2 to 4 weeks. Professional peel series with alpha hydroxyglycolic and our new AHA whitening exfoliator. A series of 6 peels 1 week apart after 1 peel every month. And then, of course, continue with your home care regime. Now, in the presentation, I have a home care regime all written out for you. And you can get a copy of this presentation by emailing me at catherine.etiologyskincare@gmail.com, and I will repeat that at the end of the presentation. This is an actual client. We did a series of peels. You can see that she not only had the hyperpigmentation was diminished, but she has smoother, brighter skin. Now, here's what we recommend for all of you estheticians out there. A series of 6 professional exfoliating peels alternating with our low 35% 2.5 pH 1 week and our alpha hydroxy whitening exfoliator the next week. You do this alternating for 6 weeks. We start off with a low dosage because you don't know how the skin is going to react. So I always use the 35% 2.5 pH whenever I'm working with a new client. And you can always move up if you see that they're doing well with that percentage. Now, you must put your client on Lightning Gel 10 during this treatment or Lightning Gel 10 with hydroquinone, and make sure your patient uses sun protection. Every client of yours should walk out with our sunscreen. There's 2 types. There's an oil-free type with glycolic for people who have actinic or blemish skin, and then there's our 30 SPF, which is a luscious hydrating moisturizer with sunscreen. After completing the series of 6 peels, give your client an alpha hydroxy whitening exfoliator professional peel once a month for 3 months, and then start the series over again if necessary. It really works well, and I can tell you by working in my own spa, I have had dramatic results. Here's the home care recommendation for the treatment of hyperpigmentation. Your cleanser is going to be Cleanser 3 or the Therapeutic Cleanser. The toner is the Replenishing Toner. Eye care is the Ultra Cream 2. The antioxidant emollient is Vitamin C. Repair and Renew is the Toner 8. Or in the evening, it's the Lightning Gel or Lightning Gel 10 with hydroquinone. The moisturizing sunscreen is Lotion 10 or in the daytime and hydrating moisturizer at night. And your hand care is Creme 20. Now, exfoliation, you can add your loofah to any of the cleansers and it automatically becomes a wonderful, gentle scrub. And the treatment mask is the rejuvenating mask that's going to feed your skin with vitamins. We're all about feeding the skin at Etiology. This is a problem acne with hyperpigmentation. You can see how she started out and she was blotchy And the after picture is very dramatic. And this is a series of 6 peels with glycolic acid and using the hydroquinone lightning gel 10. So as you can see, she had a wonderful result from that. Now, if they really have a lot of hyperpigmentation and the skin is sun damaged and leathery, you can change your protocol and start with a higher percentage of glycolic acid. You're going to be alternating the 35% 1 pH. Remember, the lower the pH, the stronger and more absorption of the product. Or use the 50% 1 pH, which is our highest level of glycolic. Alternate that with our alpha hydroxy whitening exfoliator, which is a 2.0 pH. And like the other protocol, you need to put your client on lightning gel 10 or lightning gel with hydroquinone. After completing the series of 6 peels, give your client a professional peel using the 50% 1 or the alpha hydroxy whitening exfoliator once a month for 3 months. You probably will have to start this process over again if their skin is really leathery and discolored. And here is the care of the recommendation for hyperpigmentation and acne. Of course, we have our wonderful salicylic products. We have the Cell Cleanser 2, the Toner 8, the Beta Alpha, which contains salicylic and glycolic acid, our Ultra Cream for the eyes, a fabulous product. Using your vitamin C during the day and your vitamin A at night. And using your Gel 15, that really is going to exfoliate the skin and help slough off the hyperpigmentation. Your moisturizing sunscreen is Lotion 10, and the nighttime is Hydrating Moisturizer. If you have a lot of actinic activity, I would do the Lotion 10 day and night. Hand care is your Creme 20, and of course you can mix your loofah with any of our products. The Cell Cleanser and the loofah together is a wonderful light scrub, and a treatment mask will be the salicylic mask, of course. Okay, let's talk about skin anatomy. You all know this, the epidermis, dermis, and the subcutaneous. And here's a schematic. Now, let's do some facts. I thought these were interesting facts, so we included them. The stratum corneum, or the epidermis, is 14 to 20 cells deep. It consists of dead, damaged, irregular, dull-looking, and hyperpigmented cells held together with lipids. These cells are like bricks and mortar. And what happens is the glycolic goes in and loosens that mortar and allows the dead skin cells then to be ablated. Some facts. Exfoliating the stratum corneum stimulates production of new cells. Nature abhors a vacuum. It tricks the body into thinking that the cells are gone and they have to replace them. And of course, starting down into the dermis, it will replace them with new healthy cells. You'll have visible improvement in your skin appearance. And alpha hydroxys cause exfoliation by reducing the hold of the lipids on dead skin, just like I told you. Now the cell renewal process, this is really interesting. When you're a baby, you have that dewy, soft, squishy skin. And that is because the cells are reproducing at a very rapid rate, and there's not time for the skin cells to sit on the body. New ones are replaced in a constant fashion. But as we get older, that process slows down. Now I am in the age 70 and up, and so my cells are just really barely making it. So the cellular turnover can be 90 to 100 days. And in the meantime, the cells just sit on my skin. They get impacted into the pores, and my face starts looking dull and haggard. So by using our products, I keep a constant exfoliation going, and I get that glow, and my skin is more healthy because the dermis is producing nice, healthy skin cells. The American Academy of Dermatology, they talked about what are some of the first steps in dermatological surgery. And the first thing you do is you prep the skin and get the skin ready to go. So you want to refine creases and folds. You want to use Botox and fillers and fat replacement. These are some of the things that you can do prior to surgery to make the face look great. I myself use Botox and fillers, and it is amazing. The fillers last me a long time because once the hyaluronic acid is into the crease, it starts producing its own collagen. Alpha hydroxy acid, it reduces the skin's dryness. It reduces the buildup of outer dead cells, helps reduce fine line, and it helps reduce hyperpigmentation. It also stimulates cellular growth, as we talked about. It improves the microvascular blood flow. It gets those nutrients up into the dermis and the epidermis, and it feeds the skin. It improves the clarity of the skin, and it prepares the skin for other treatments. Now, let's talk about the alpha hydroxy acid family. Everybody wants to know why we use glycolic acid. Well, by far, it has the smallest carbon. The smaller the carbon, the more penetration you'll get down to the source of the skin, to the area that you really want it to work. The next lowest one is lactic acid, which is sour milk, malic acid, which is apples, tartanic acid, which is grapes. You have your citric acid, and you have your mandelic acid. And mandelic acid also works on hyperpigmentation. Now, our home care products contain 2 to 20% alpha hydroxy and a pH from 3.5 to 4.5. I like to layer products, so the use of multiple products to produce an effect is really paramount in having good skin and really working with this hyperpigmentation problem. Your professional exfoliation peels start at 35, 2.5%, go all the way up to 50, 1 pH. And they are excellent, and they really work well, and of course you have to combine that with home care for optimum results. All right, let's talk a little bit about how pH affects the skin. The pH of human skin is between 4.5 and 5.5. Products with a lower pH, more acidity, have a greater potential for absorption. That's why I say you may have a glycolic product that says it's 70%. You're going, wow, that's really strong. But then it may have a pH of 4. And so what that means is that this product may have a high percentage, but you're not going to get the results you want because the pH is so high. You're not going to get the absorption that you think you should with a product that's 70%. So the concentration, the pH, and the regimen are directly proportionate to the results. In other words, the product that you use and the home care regime, it really is very important to the results that you want to get. I put together this chart. I found it really interesting. I like to go to the drugstore and get some pH strips and test different products. You would be shocked at some of the products that are over the counter. For instance, a lot of the soaps that they have for acne, they're way up on the scale of a 12 or 13, where bleaches and oven cleaner are listed. They're very alkaline, and they're very irritating to the skin. Now, the lower the pH, the more absorption you get. So if a pH is at 1%, you're going to get a lot of absorption into the skin, and the product's going to work better. Neutral is 7. On the acidic level, you want the product to be in a lower pH if you want it to go into the epidermis and go down into the dermis. And on the alkaline level, very few of our products are alkaline because they can be very caustic to the skin. So it's very important that you check the pH of all of your products. If the pH is around 5 or 6 and you want it to be a product that's going to go in and really have visible results, you probably won't get much. But if you have a product that is in the lower ranges like 3 and 2 and 1, you know that the absorption is going to be greater and that you're going to get more visible results. For the pH and the percentage working together is very important. So check all of your products that you have. The lower the pH, the greater the stimulation. We talked about that. And here's your cell division. A 3-point pH, your cells are turning over at 34. A 5, it's 23. And of course 7, which is neutral, is 10. And it's hardly worth the effort. So this is our range of skincare for hyperpigmentation. A home care we talked about before. We have cleansers, astringents, moisturizers, treatment products, and sunscreens. And then our professional care is we have our pre-peel cleanser, our post-peel balm, our professional exfoliating peels starting at 35% 2.5 and going all the way up to 50% 1 pH. And of course our wonderful new alpha hydroxy whitening exfoliator. It's 30% and it's a 1 pH. Now Salon Professional exfoliating peels for hyperpigmentation. Highly effective if the pigmentation is within peeling depth. Remember, in the state of California, you are not allowed to go into live tissue, so you're only allowed to do very superficial or superficial peels. And then also peeling in combination with, always do your hydroquinone or your kojic acid because it's much more effective and it controls the existing pigmentation and helps prevent future hyperpigmentation. And of course, don't forget your sunscreen. Let's talk a little bit about the etiology products used in the treatment of hyperpigmentation and hyperpigmentation with acne. We have our Cleanser 3, which is our workhorse of the line. It gently exfoliates a cleanser for the face and body. I put it in my shower and I use it all over and it's wonderful and it gets rid of bacteria, makes my skin feel nice and dewy. It doesn't strip it of the moisture. It's a 3% glycolic acid with a higher pH, the 3.9 to 4.0. You don't want it to strip the natural mantle on the skin. It's excellent for all skin types, and sensitive skin apply to wet skin for a little bit of neutralizing. You can use it as a shampoo for itchy scalp. If I have a little psoriasis on my head, I'll take some and I'll massage them in, and it really does help that. And of course it contains no sodium lauryl sulfate. It's a non-alkaline formula and it's fragrance free. It is a wonderful product. Every esthetician should have this on her back bar and every retail person should have this to use. Toner 8, it has an 8% glycolic acid. It provides a removal of surface oils and fats. It's excellent for oily and acne-prone skin. Teenagers can use it twice daily to combat oily skin and breakouts. You can also use it on your T-zone. It's an excellent product. I recommend it. I love the Beta Alpha 10. It's salicylic acid, 2% and 8% glycolic acid. It has a lower pH and has an antiseptic action. It helps reduce bacteria and keep pores and follicles open. It's best suited for moderate to severe acne. Excellent for teenagers, and it provides the two most popular exfoliants on the market today, which is salicylic and glycolic acid. It can be used on other areas of the skin, such as on the back or after shaving. Gel 15. This is our strongest gel that provides therapeutic results. It's 15% glycolic acid with a pH of 3.5 to 3.8. It's for wrinkled, significantly photodamaged or acne-scarred skin. It reduces the buildup of dead skin cells. It keeps those cells going at a nice rate. Its antiseptic action keeps pores and follicles open. I use it in conjunction with vitamin A to stimulate the rapid growth of new cells. It's excellent for arms, legs, neck, chest, or back, or ingrown hairs from shaving. Let's talk about the specific products. Our lightening gel with hydroquinone, our lightening gel with kojic acid and ascorbic acid, vitamin A, and vitamin C. Now, our lightning gel with hydroquinone was developed to treat hyperpigmentation specifically. It combines 2% hydroquinone with 10% glycolic acid. It has a lower pH of 3.8 to 4.2. It helps reduce pigmentation from acne. Always consult your physician if pregnant or nursing. You might switch over to the kojic acid. It's great for treating age spots on the hands and chest area. Don't forget that area. I have a lot of clients that come in with a lot of sun damage on their décolleté, and it never occurred to them to treat that area and to wear sunscreen on their hands and on their chest. Always apply sunscreen after application and best if used within 6 months. Our lightning gel 10, now this is the one that contains ascorbic acid and kojic acid. It inhibits the production of melanin without the use of hydroquinone. It has a low pH of 3.7, and this is what you use if you have a sensitivity to hydroquinone or you're pregnant or lactating. It also works better for darker skin and for Asian skin. Vitamin A, and vitamin A was 7%. It has visible results. It rejuvenates the health of the skin. It contains 7% retinol palmitate, which we know is the most stable vitamin ester. The pH is low at 3.5 to 3.7. It doubles the cellular turnover. So whatever your rate is, it's going to double the turnover rate. And I don't know about you, but I'm all for that. It thickens the epidural layer and plumps out the lines. It won't cause redness or irritation or photosensitivity. It's beneficial for all skin types. You can use this before gel 15 to expedite the cellular renewal process, but that's only for clients who have a lot of sun damage and tend to have thicker skin. For clients that prefer not to use Retin-A or Renova but want the results, this is an excellent product. I use it. And of course, consult with a physician if pregnant or nursing. This is a patented product, and we're very proud of this. And there's nothing on the market like it, and it is very, very effective. Let's talk about our vitamin C and our vitamin C with 25%. Vitamin C firms the skin and increases the skin's elasticity. The first vitamin C product developed for topical application. It contains 25% ascorbic acid concentrate with a low pH of 3.5 to 3.7. It increases the fibroblast cells, and all of you estheticians out there know that this really helps in collagen production. We got to get that matrix nice and tight. It inhibits the UVA and UVB. It contains 1% pronogenol. You may not have heard of pronogenol, but it's the most powerful antioxidant available. It's 50 times stronger than vitamin E and 20 times stronger than vitamin C. And this is a patented product. You are not going to find a better vitamin C product on the market than Etiology's. The importance of sunscreen. How do sunscreens work? They scatter, reflect, and absorb. The SPF number is not proportional. For example, SPF 30 absorbs 97% of sunburning rays, and SPF 15 absorbs 93%. Now, I know that the dermatologists and the doctors will tell you to go get as high of a percentage as you can. And there's nothing wrong in that, but remember, you're not going to be getting exactly the 50% or the 100% SPF that's on the packaging. The trick to sunscreen, no matter how high the SPF is to reapply the sunscreen at noon, reapply the sunscreen around 3 or 4, because the natural oils and sweat of the skin is going to absorb it. So for you to get a really good protection against the sun, you really need to be vigilant and reapply every few hours. There is significant damage from UVA and UVB exposure. We've actually found DNA damage, carcinogenesis, immune suppression, oxidative stress, free radical damage. It reduces our antioxidant barrier. It reduces our lipid barrier. it destroys cells, it destroys collagen, and it causes hyperpigmentation. The sun is not your friend, and I keep telling my clients, wear your sunscreen. Even if it rains or snows or the sun is not out, the rays are always there. UVA exposure and collagen. The sun stimulates the protection of colonase, which is in the skin, and colonase destroys the skin's collagen. Only 5 to 7 minutes of UV exposure can cause damage to the skin. I've had clients say, well, I only go from my house to my car and my car to my work. What do I need sunscreen for? Well, here's the evidence. Only 5 to 7 minutes of UV exposure can cause damage to the skin. The skin is also damaged when you're driving because the sun comes in on the left side of your face. And those of you who are estheticians will notice that more pimples and more sun damage is on the left side of their face from driving than on the right. What does the SPF really mean? Well, it's sun protection factor is what it means. It means 50, if you normally burn in 20 minutes, you should receive protection 20 times 15 minutes for 5 hours. That's the formula. SPF does not apply to UVA protection. This is UVB. The American Association of Dermatologists, this is their sunscreen recommendations. Start applying sunscreen at 6 months old. Younger than 6 months, keep that child out of direct sunlight. I see people at the beach all the time with their babies and their little baby carriages, and their sun is beating down on them. Keep them out of the sun until they're 6 months old and then apply the sunscreen. Apply sunscreen 20 minutes prior to sun exposure. It takes time for it to absorb into the pores and add that barrier of protection. Avoid the sun 10 a.m. to 4 p.m. If that's not possible, try to get most of your tanning in around 8 to 9 o'clock or after 4 p.m. You can still get tan, but you won't get those damaging rays. Wear a 4-inch wide brim hat and use an SPF 15 or above daily. Sunscreen key points. Here's what's happened. Skin cancer is at the highest level ever, and the reason is people are lulled into a false sense of security by getting an SPF that's like 50 or 100, never reapplying, and they say, oh, you know, I'm covered. I've got this really strong SPF. 90% of premature skin aging is due to sun exposure. There are two types of UV rays. The UVA is the long rays known as the aging rays. Therefore, UVA stands for aging. The UVB is known as the burning rays. So the UVB is known as burning. Both cause photo damage. Our sunscreen provides protection from UVA and UVB and contains SPF 20 to 30%. Specific products: Lotion 10, Oily Combination, Creme 10 for dry skin. This is for acne. Lotion 10 with SPF 20 for oily skin, or sunscreen SPF 30 if you have dry skin. Protection. We have Lotion 10 with an SPF 20, which does have 10% glycolic, and we have a wonderful luscious sunscreen SPF 30 that is non-glycolic and has a luxurious feel. They both protect you from UVA and UVB rays. Now let's talk about the specific products. Lotion 10 with our SPF 20. This is a light lotion that absorbs immediately into the skin. It's great for blemished skin, sensitive skin. It contains 10% glycolic and the pH is 3.7 to 3.9. It was developed for combination oily skin types. It protects from damaging ultraviolet rays. Non-greasy and penetrates immediately. It's 3-in-1 treatment. It moisturizes, resurfaces, and it has sun protection. Now we have our Sunscreen 30 SPF. It is non-glycolic. It provides moisture and sun protection. It moisturizes dry, aging skin. It's great for post-laser, peels, and taking a break from glycolic acid. It may be used on all areas of the body, and it can be mixed with cream 10 for sensitive skin. Let's talk about some hyperpigmentation key points. No therapy can be effective without consistent sunscreen use and minimal exposure. Hydroquinone inhibits the skin's production of tyrosinase, which forms melanin. Etiology offers two treatment-specific products, Lightning Gel 10 and Lightning Gel 10 with hydroquinone. Glycolic with hydroquinone is proven to be the most effective. For your professional cabin use, we have our pre-pep, our post-balm. We have our exfoliator 35%, 2.5, all the way up to 50% pH of 1. And of course, our alpha hydroxy whitening exfoliator 30% of pH 1.9 or 1.0. We provide webinars, custom training for your place of business, interactive website, monthly newsletter and updates. You can contact me at 360-460-9111 or email me at catherine.etiologyskincare@gmail.com. It's been my pleasure to present this to you. I want to thank you on behalf of Etiology. We are dedicated to the advancement of skin therapy through medical science. We are a partnership of estheticians, schools, dermatologists, and plastic surgeons, and we're very proud of our new line. I'll talk to you soon. Thanks so much.